So my disorder was the cleft palate. So, what is a cleft palate? Well, a cleft palate is when there's an opening or split in the roof of the mouth. It usually occurs in newborn babies, as you can see here. So the causes: cleft lip and cleft palate occurs when tissues in the body, in the baby's face, and mouth don't fuse properly. So symptoms. The symptoms of a cleft palate are a split in the roof of the mouth, lip, and or upper gum. These can cause difficulty with feeding, swallowing, and speech. So the diagnosis. A cleft palate is diagnosed right away at birth, as it is extremely easy to observe. If there is a split in the upper lip or palate, a cleft palate is present. No special tests are required, but they can also be observed before birth using an ultrasound. So let's go into treatment. One treatment to a cleft palate is a minor plastic surgery. This involves reconstructing the gap that is present to achieve a normal and functioning look. Another treatment for a cleft palate can be flap surgery. This is where you take tissues from one part of the body and you move them into the split in order to reconstruct the lip. So you got the prognosis. Prognosis for someone born with a cleft palate is long-term but minimal scarring, so you'll have scarring at the lip, and short-term speech problems. These can be assisted and helped by going to a speech therapist or speech specialist in someone's education. So body system effects. This can affect the digestive system by making it difficult to obtain nutrients and food to the stomach. And it can also affect the skeletal system by hindering tooth development that is part of the skeletal system. So the doctors involved. A pediatric surgeon would be involved in the reconstruction of a palate. A neonatologist can be useful in providing care for the affected infant. And otolaryngologist may be required, as babies with a cleft palate are more susceptible to middle ear fluid and hearing loss. The otolaryngologist can work to monitor and drain the fluid, keeping the infant's ears healthy. And as you can see, we have a table showing that females tend to have a greater chance of getting a cleft palate, but males have more chance of getting a cleft lip. And as you can see, this only occurs in 16% of the tested population in this graph. And here is the works cited.